Testing. Ah, fuck, I was hoping this wasn't gonna happen. Excuse my French.
Yes, pretty much looks solid.
Hello, Cristin. I have your audio, but no video yet.
Can you hear me?
I can hear you. I can't see you yet.
Okay. Start video. Can
There
see-
you go.
Hi.
Hi, good morning.
Good morning. How are you?
I am good. How are you doing?
I'm good. I'm so glad that it's working. I had to do this yesterday in a different platform, and they couldn't hear me. They could see me. They could see my screen, but they couldn't hear me, and so we had to reschedule it. So I'm glad it's working right now.
Oh,
So and I'm not very tech savvy, by the way. I'm Cristin, by the way. You probably figured that.
Yes, I saw your name. There you go. Let me just look on here. I want to see how I can share your screen.
Okay.
You know what? Actually, request to share your screen, and let me see if I can.
Okay, so there's a thing here that says share screen. So I'm clicking it. Okay. So okay, here is what I wanted to share. Can you see anything?
I cannot see anything yet. Yep, I got it. It's up. Perfect.
Okay, so I cannot see it. Hang on.
Yeah.
Oh, there, I can see it.
Hey.
Perfect. Okay, and let me see if I can advance it. Okay. There you go. Okay, so you're just seeing the slides, right?
I am.
Okay.
That's terrific.
Okay, perfect. Perfect.
Great. All right,
Okay.
I'm gonna switch it back. Now Chuck is gonna be emceeing the whole thing. So
Okay.
I am going to I'm going to be the tech guy. I also kind of chime in and do other things, but that will allow you can turn your sharing off for now.
Okay, and how do I do that?
It should say quit sharing.
Quit sharing. Oof. Where would that be? Okay, but black or unblack slideshow? No?
No.
Oh, there you go. Stop share.
Stop share. That's it. Yes.
There you go. Okay.
Correct.
And then if I want to share, okay, sorry, I'm going to do it again. If I wanted to share, I would click this and okay, do what I need to do. Okay. All right. Got it. Perfect.
We're just I'll be for right now. I'm going to be admitting people, and we'll just I'll say hello, and then Chuck will start at 11:30, and then things will be good. It's great to have you. Thank you so much. I mean, with everything out there happening, and I continue to have questions because we got an email from a friend the other day from something that the Texas Board of Health was sending out that scaled everything from like less severe to severe interactions. Or I actually wanted to send it to you so you could take a look at it. I'm like, I don't think visiting a sick friend is moderate in what we should be doing, or who judges moderate.
No, I don't think I've seen that document. So
I'm gonna, you know what? I'm gonna go over here and send it to you while we're waiting.
okay.
Hi, Cristin. Steve Rosenthal on the board.
Hi.
Thank you, and we're very grateful that you've made time available.
Happy to help. I hope that I can answer the questions that are, needing answers.
I have a couple to start us off in case to prime people to ask questions, but I'm sure you're going to get a lot.
Okay. Sure.
And they're real questions that I have.
Yeah.
It's not like they're not going to be simplistic or just dummy questions.
Okay. Hopefully, some of the questions will be answered by the presentation that I'll provide, but absolutely open to, additional questions.
Terrific.
Mhm.
Okay, it's 11:25 right now. I'm just looking for this document so I can send it over to you.
Okay. video. And go off for a sec.
Sorry, I'm on a different computer today, so it's still working out the best system for this. Let's see if got any more people. Yep, I'm going to admit some more people here. And Chuck is joining us. He's going to be our MC today. There we go. Find this. You can't hear. Try to speak. Do you have speakers? Okay, check and see if your speakers are on. Sorry, guys, I'm just doing technical stuff. Ah, here it is.
And now my
Okay, got it. I'm going to send this to you, Cristin. Cristin, what's your email?
C Mondy at
See,
P.H.
it's M-O-N-D-Y
NDY at P.H.
P-H
dot LA County
LA County
.gov.
.gov. Okay, great. I'm going to send this over to you.
hello, everybody.
Good morning.
Good morning. Good morning, Meg. Good morning, Lenore, Stephen, and our guest, Cristin.
Hi.
Good morning.
morning.
Hi, Cristin. How do you pronounce your last name, Cristin?
Monday?
Mondy.
Yes.
Thank you.
Mhm.
I just need to do something here really quick. There we go. Nice to see everyone's smiling faces.
Hello.
And some coffee sounds delicious.
Great.
I'm just
Oh, good. Kim's joined us.
doing the old unmute and admit right now. So, Chuck, the ball is in your court.
Excellent. It's 11:29 on my computer, which may or may not be accurate. You want to give it just a moment more for a few more people to join?
Yeah,
Yeah.
of course.
All right.
Great idea.
Hi, Jennifer. Welcome.
Hi, nice to meet you all. I'm the new field rep
Excellent.
for the congressman. It's nice
Yes.
to see you all today.
Yay,
We're
Ted.
so glad you're with us today. That's
Yeah.
excellent.
Hi, Jennifer.
Hi.
Yeah, we're still getting people coming in, so I'm just going to be flipping back and forward. So pardon me if I look distracted. I am.
Good.
Here.
Welcome, everybody. We're just giving it a few moments until a few more people sign in. They're coming in quickly. So just go ahead and look at some of the smiling faces before you.
Oh, hi. Hello.
Welcome, everybody.
Guy just joined us.
Morning.
So glad that Jane's with us.
Cristin,
And Mariko.
Yeah, Mariko's here. Mariko, Cristin, at one point, when we get everybody admitted, I'm going to mute everybody except for you and Chuck and myself. That keeps the interference down.
Great.
Excellent. Adriana's joined us. That's excellent. Aurelia's with us. Jane's with us. Kim's joining us from San Francisco.
Oh, nice.
Beautiful thing.
Lisa's coming in. Here's Karen.
Oh, and Lisa. That's great. Jill, thank you for renaming yourself. We can see who it is at the Museum of the Holocaust that's here. I love that. Thank you.
Morning, Lisa.
Still is the museum. Hi, guys.
Hi.
I am back there. You need to be in the light.
I'm going to the light.
Good.
And Karen's in silhouette, but she's an artist, and that's.
There we go. Okay. Miss seeing
Excellent.
everybody.
Excellent.
Yeah.
Much
Here
better.
we are.
Well, great.
All right. Shall we get started?
Yes, Chuck, anytime you're ready, and then I'll just keep admitting people as they come in.
Excellent. And hold on, just
Everybody, and then I'm going to unmute you guys, so just give me 1 second to do that. Okay.
hey, so welcome everybody to the Greater Miracle Mile Chamber of Commerce. I'm Chuck Marcourt, co-owner of Red Real Estate Group and proud member of the board of directors for the Greater Miracle Mile Chamber. I know I'm glad to see everybody and to hear from our amazing guest, Cristin Mondy, today. And of course, to interact with anybody besides just my husband right now. So I'm so excited to be here on this call. Before we get started, I want to thank Meg McComb for once again putting together an excellent program for all of us today, and to Chris Devlin, our IT manager, who's gracefully keeping us on track. Thank you both for all your hard work. We so appreciate you and everything you do in putting these together. So yay, everybody. All right. Before getting into talking to our main guest, we wanted to introduce Jennifer Harbick, who's the new field representative for Congressman Ted Lieu's office. She'll be covering the Miracle Mile area, and we're so happy to have her here with us today. Jennifer, would you like to give a quick hello and just tell us a real quick bit about yourself? Let's unmute her.
There,
There we
I
go.
unmuted. Hi, everyone. My name is Jennifer Harbick. As you mentioned, I am the new field representative in the office of Congressman Ted Lieu. I was with the office for a year previously as staff assistant, so I'm recently in this new role, and I'm really excited to be representing this area and, you know, providing you with ledge updates. I actually do have a few ledge updates, if that's okay, to provide that to all of you. I just wanted to let you know that the Congressman sent a letter on July 9th urging the Small Business Administration to allow EIDL loans to count towards expenses for COVID-19 safety compliance, specifically CDC recommendations for businesses as working capital expenditures. This would include using the funding for things like plexiglass dividers and PPE, which many businesses are using to reopen safely. I also want to let you know that we do a lot of casework assistance for constituents, a lot right now related to the IRS, the SBA, Small Business Administration, USPS, for mail issues. And this is really a useful way for constituents to get that open line of communication between them and federal agencies, and we're happy to help in any way we can with that. I also want to let you know that we have two important virtual events that are upcoming. One tonight. Tonight at 6 p.m., the Congressman is hosting a virtual conversation addressing structural racism, and you can tune into that on the Rep. Ted Lieu Facebook page. So that's super exciting. And also next week, the Congressman is also hosting another virtual event specifically about small business resources. It will be on Tuesday, July 21st at 6 p.m. on the Rep. Ted Lieu Facebook page. And you are all welcome to submit questions that you may have. That closes at 5 p.m., but you can submit them to the lou.staff@mail.house.gov email if you would like. And I'll be sending that information to Meg after this meeting. But I'm really excited to be working with all of you. And if you have any other questions, you can always reach out to me at my email, which I'll also be providing to Meg after this meeting. So thank you all for inviting me, and I'm happy to be here.
Excellent. We're so glad that you're here. Thank you for being with us, Jennifer. And would you be able to, in the chat feature of this, just put a link to that Facebook page?
Yeah, absolutely. I can definitely do that.
We so appreciate that. Thank you. All right. And so, without further ado, our guest today is Cristin Mondy. Cristin Mondy is the Regional Health Officer for the Los Angeles County Department of Public Health, Metropolitan Los Angeles, SPA4. She directs the operation of core public health services for approximately 1.1 million residents within this region of Los Angeles County. Ms. Mondy is responsible for field staff operations related to communicable and chronic disease prevention and community engagement. She maintains relationships with community partners to design effective and evidence-based community programs to support the development of healthy, safe, and active environments throughout metropolitan Los Angeles. And, you know, before we really get into things, Cristin, I'm wondering, you're arguably one of the top public health officials in the country, not just in Los Angeles, overseeing 1.1 million constituents. That's extraordinary. And I'm wondering just a little bit about you. What motivated you to get into public health?
So I'm trained as a registered nurse. So for many years I've been working as a registered nurse in the hospital and other areas. I also did teaching in nursing schools, but then I was really interested in public health versus because it's population, you're working with populations and you see impact in populations rather than individual patients. And so my career the last 20 years has been with the Department of Public Health, and just learned a lot. And with Los Angeles County, it's such a large jurisdiction, right? Like 10 million people. There's so many things that are happening. It's very encouraging for me and, inspiring to be part of just protecting the health of the residents in Los Angeles County.
Yeah, excellent. And you're going to be sharing so much great information with us in the next few minutes about what businesses can do with the current guidelines and how we can operate and keep our customers safe and keep our employees safe, keep ourselves safe.
Absolutely.
And all that good stuff. And I'm just wondering, before we get into all that, how are you coping with the pandemic on a day-to-day basis right now in your life?
Gosh, I think like the rest of the world, there's challenges, there's struggles that I have to deal with like everybody else. I mean, I have to quarantine, dealing with it personally. My husband is a business owner as well. So, we feel that with his business. And then having to work like really long hours. I've been at this since January, even before, because in Los Angeles County, even before we started seeing cases, when the cases were in China, we were already preparing for it. So it's tough, but we have to. Luckily, I work with a great group of people within our health department. There's a lot of help with our communities, so I'm getting through it. Just like everybody else, try to keep positive and know that we will get through this, right? Even though it's very challenging, there is light at the end of the tunnel, however long that tunnel is, right?
Yeah, absolutely. And so I guess without further ado, we'd love to hear from you about what businesses can do to protect our our workers and ourselves and our clients and all that good stuff. So take it away.
Sure. I actually have a PowerPoint presentation, so I'm going to do my best to share it. Here you go. Let me see. Can you see the slide?
We can.
Okay. All right. Let's get started then. Let's see if I can advance it. Okay, so I first want to start by providing some numbers, and you can see it here on the screen. Yesterday, we reported an additional 2,758 new cases, which brings the total number of people who have tested positive for COVID-19 in Los Angeles County to 143,009 cases. Unfortunately, we also confirmed 44 new deaths, which brings the total number of deaths to 3,932. The total number of people tested in Los Angeles County is 1,409,000, and our positivity rate is 9%. Of those, 9% have tested positive. So on Monday, you may have heard that the Los Angeles County Health Officer order was modified to align with Governor Gavin Newsom's directives to prevent more cases, more serious illnesses, increased hospitalizations, and more deaths. The order requires the closure of the following sectors for all indoor operations. So gyms and fitness centers, places of worship, offices for non-critical infrastructure sectors, personal care services, including nail salons, massage parlors, and tattoo parlors, hair salons and barber shops, and indoor malls. Bars, indoor dining at restaurants, indoor museums, indoor operations at zoos and aquariums and card rooms, as well as satellite wagering facilities remain closed. And all events and gatherings, unless specifically allowed by this order, remains prohibited. So in the past few weeks, we saw the effects of the reopening of key sectors. We saw that there was a steep increase in outbreaks in work sites. And these are all kinds of workplaces and includes warehouses, manufacturers, mail services, distribution centers, waste management, as well as retail. And as you all know, there are real consequences to not following the infection control directives that are already put in place. We must really, ensure that we're following these guidelines because people's health and livelihoods are at stake. We're really calling on the public, all business owners and community organizations to support the safe reopening of businesses and public places. We've provided sector-specific protocols which outline the steps that businesses, organizations, and the public need to take to help slow the spread of COVID-19 at these sites. As we move through recovery and as new sites start to reopen, it's extremely important that businesses comply with the protocols to help keep the public safe and prevent potential outbreaks of COVID-19. These protocols can be found on our website and includes information about sanitation, disinfection, and necessary PPE. Additionally, our department has begun to develop comprehensive toolkits that compile all the necessary guidance documents for each of the sectors into one toolkit. Currently, we have a toolkit available for retail establishments, but we will continue to provide more in the coming weeks. As more people return to work, it's really important to note that the workplace itself must change in an effort to protect employee and customer health. The workers' rights documents highlight some of the protections that employers are required to put in place to keep employees healthy. This can also be found in our website. It's important to maintain 6 feet of distance as much as possible between both co-workers and customers or members of the public that you must interact with, and to be sure that your cloth, you're wearing your cloth face covering. You can space out desks, workstations, or production line work by at least 6 feet, and if necessary, incorporate other sorts of barriers such as plexiglass dividers to ensure physical distancing. Employers should also develop policies for worker protection and provide training to all cleaning staff on site prior to providing cleaning tasks. Employers must ensure workers are trained on the hazards of cleaning chemicals used in the workplace in accordance with OSHA's hazard communication standard. We are asking that you post signage to provide clear guidance to the public about how to maintain safety within the business, which of course, as I've already mentioned, maintaining physical distance, wearing face coverings, etc. And the signage should also state that all employees and visitors should avoid entering the building if they have any symptoms of COVID-19. If you have 3 or more confirmed COVID cases identified in your workplace within 14 days, you need to call public health immediately, and those are the phone numbers up there. Once you call us, we're going to initiate a response that includes assigning a case manager to guide the facility response and provide technical support. We're going to provide you infection control guidelines and also site-specific control measures. In a couple of slides, I'm going to tell you what you should be prepared to report once you make this call. But right now, I want to talk about what you should do first when you find out that your employee has COVID-19. So there's 3 main things, and I try to do it color-coded here. So the first thing you need to do when you find out that your employee is suspected with COVID-19 or is confirmed with COVID-19 is to ask that employee to go home. They obviously cannot be working. They need to self-isolate, which means staying home for 10 days from when the symptom began, plus 3 days after recovery. So if they were diagnosed 10 days before and it's already been 10 days, but they still have symptoms, you need to add an additional 3 days to those 10 days. You might be hearing that some people who have tested positive don't have symptoms, and so for those people, they need to self-isolate for 10 days from the date when they received their positive test. So in addition to those people that have been tested, confirmed as COVID cases, the employers also need to identify anybody who has been in close contact with that case and encourage them to home quarantine and get tested for COVID-19. So close contact is defined as anybody who was within 6 feet of 6 feet distance with the confirmed case for longer than 15 minutes. And this is while the employee was sick and also 2 days before the employee started showing symptoms. Close contact should quarantine at home for 14 days from the last exposure to the case. So in addition to that, we would also ask that you continue to monitor anybody who is at your workplace, as well as your customers who for your businesses, and consider screening them for symptoms. And those include asking them if they have signs and symptoms. Some businesses have chosen to do temperature checks where you don't have to touch them with the infrared thermometers. So as I said previously, if your work site has 3 or more confirmed cases, you need to call the health department. And if it's just 1 case, you don't need to notify us, but you need to implement, the 3 things that I asked you to do in the previous slide. But for 3 or more cases, when you call, you need to be prepared to provide information about the following. hang on a minute. So you're going to be asked to report the name and date of birth of the cases, the last day they worked, where they worked and what their duties were, who they have been in close contact with, the number of employees in your facility. And then the health department will determine if this is indeed an outbreak and provide additional direction. Hang on a minute. Let me see. Okay. So for the past few months, we've deployed a lot of health investigators out to do inspections, you know, in the different establishments, right? And prior to Monday, there were a lot of establishments that were open, and they were allowed to open, that there were some restrictions. And our health inspectors have found a number of violations and non-compliance from the different establishments. And here in this slide, I'm just giving you some common examples of what our health inspectors have found. Several businesses have not completed their plans and protocols. They haven't provided copies to employees or posted the required documents in their facilities. We also found that employees and customers were not wearing face coverings, and some sites were not adhering to the physical distancing requirements that the health department has you know, put in place. I wanted to share this resource in case you don't have it. Hopefully this will be helpful to you. So it's the LA County Disaster Help Center, and it's a collaboration between the Board of Supervisors, LA County Consumer and Business Affairs, and Workforce Development, Aging and Community Services. So this is a website and a call center that can provide information for business owners, for workers, for nonprofits, tenants and landlords. For business owners, you know, it can help you navigate emergency loan applications and help individuals that were recently laid off due to this emergency. For workers, there's information about wage complaints, job searches, unemployment, and industry resources. Nonprofits can access grants and emergency loans. And for tenants and landlords, they can, you know, this site can help them keep up with the latest information on the county's rent stabilization ordinance, eviction moratorium, rent resolution, or foreclosure avoidance, to name a few. So as many of you know, information and guidance is constantly changing. So I urge you to check our website for the most up-to-date information. We also do weekly telebriefings for different sectors, including businesses. Hopefully some of you are aware of these telebriefings and have listened to those. If you want to be included on the list, you can email you know, at this email address, liaisoncovid19@ph.lacounty.gov, and you can be included in the list. And they're going to ask you to you know, specify which sector you want to be included in. And for this group, I would imagine the business sector. So I know today's news may be disappointing, or you know, what we've been hearing during the week with the numbers surging and rising, but I just want to remind you that we've flattened the curve before, so I'm really confident that we can do it again. If we make sacrifices, like I said, which we've done before, we're going to start seeing decrease, hopefully, in the number of cases, the number of hospitalizations and deaths, and we'll have created a new normal that allows us to continue our recovery journey. This is truly a community effort, and we have the power to slow the devastating spread of this virus if we all do our part. And I want to thank all of you because, you know, I know that a lot of you have been doing your part, and the fact that you're here part of this, you know, telebriefing, or what do we call this? You know, whatever it is, Zoom meeting that we're doing, shows that you're really interested and, you know, want to help our community get back to the path of recovery. So that's
Cristin,
all I
thank you.
have. So I mean, I'm happy to take questions if you want. I think I'm going to stop sharing so that we can take this off of the. There you
Great.
go.
Excellent.
Excellent. And so there's many ways that you can ask questions. You can raise your hand physically like that, and Chris and I are paying attention to that. You can raise your hand virtually in the chat or participant feature, and you can also just type in a question if you prefer to do that. I'm going to get things started off with a question. Cristin, I'm wondering, for an office setting, I'm in an essential service in real estate.
Mhm.
And in an office setting, I'm wondering what an appropriate disinfection plan would be in an office.
So they actually in the in our website, there's some matrix of what the cleaning is, like regular cleaning, expanded cleaning, as well as deep cleaning, right? And for that, as long as you, it would be, I think, the regular cleaning with the EPA recommended disinfectants, and you know, just making sure that you're cleaning more frequently the frequently touched surfaces. But I can, you know, if I can send over that matrix on the disinfection for the different businesses. Mhm.
Great. If
Let me
Thank you.
let me make a note
in the chat, or you can email me and I can email it out to the chamber, that would be terrific.
Sure. Okay. Mm-hmm. I think I'll put, what I'll do, Chris, is I'll put, and even if you wanted a copy of this presentation, I can have my staff, I think my staff, Tiffany, has been communicating with you guys. So I'll keep a list of, in addition to the presentation, if you're interested, we can give you a copy of that and whatever else you request. And so the first on my list is that cleaning, you know, the matrix for disinfection.
That would be terrific. Lenore.
Can she explain testing? It's very confusing. If you have no symptoms, should you be tested? I mean, if you want to be tested, do you have to be asymptomatic or showing symptoms? What is the protocol for the testing?
Sure. So right now, even with the testing, we're trying to, you know, in the beginning, when we had limited testing capacity, both with, you know, the testing supplies and laboratories that could test, it was just the people who were really symptomatic. But now that we've expanded testing and private labs and your physicians, your private providers are able to do that, we can test more people, right? And obviously, if you're symptomatic, you should get tested and call your private provider. If you were in contact with somebody who was a case, and again, close contact, like I said, is within 6 feet for more than 15 minutes, you should request to get tested. But right now, for people who, because we're seeing that people are, you know, asymptomatic, and we're seeing that there's a lot of community spread, where, you know, you can contact your physician and you can ask to get tested if you're interested. We also have several testing sites all over the county, and then I guess maybe that's one more thing that I can send you is the website for where you can get tested, and it should be free. Testing should be free. But the thing is, you know, when you get tested, there's several different tests, right? And the most common one that we're using is to get tested if you have COVID-19. When you get tested, you get the result, and it only tells you at that point in time if you're positive. And sometimes, you know, like I told you, the incubation period, and that's why we tell people to quarantine for 14 days, because the incubation period is pretty long. It could take up to 14 days. So if you were exposed, for example, yesterday, it takes, like I said, you might not even get infected, or you know, it could take up to 14 days from yesterday. So if you got tested tomorrow, you may be negative, but then, you know, 14 days or 12 days or 5 days from now, you can be positive. So I just want to, so there's limitations to what that test can tell you. And so, you know, I just wanted people to explain that that gives you your status at that point in time when you were tested.
Gotcha.
Thank you. Is that helpful?
I see you, Kim. I have two follow-up questions, if I may.
Sure.
One is that my fiance and I tried to log on and for the testing, and we ran into one. It was asking for our insurance, and the other one it asked to be emailed or phone call. Now I never received a phone call back, and I think she received an email, but there was no response after that. You know, you're saying that the testing is still free for COVID-19 for the initial test, not the antibody, but the other one.
Yeah. That's correct. So right now, there's a lot of people that are requesting to be tested. So I think so the priority is for people who are symptomatic and for people who were recently exposed to a case, right? Although you can request, anybody can request for testing, because we still have, even though we've expanded testing, there's still some limited capacity. It's hard to get tested, get same-day appointments. So there is still some, we are getting reports that some people are having difficulty getting tested. And that's why we would encourage you, if your private provider is able to do it, because insurance covers it, that to try and go that route.
Gotcha. And
sometimes some laboratories are reporting, or testing sites, that like they don't have enough reagents, or there's other logistical issues, even if they're able to test.
understood. And last question on this, and then Kim, you're next, is that the other test for the antibody, I've heard multiple rumors about this. In fact, we have a friend in New York whose roommate was tested positive. And in fact, the entire cast of the Broadway show that they were in was positive. And his roommate, the woman we knew, her antibody test came out negative. When she actually went through all the symptoms, we saw it because we kept in close contact with her. So how accurate are these antibody tests?
Yeah, so we're still, because this is COVID-19 is new, we're still learning a lot. We are getting reports that it's not as sensitive or as reliable as it should be. So the serologic testing that you're talking about, that's so what it tests is like it's tests if you have antibodies, which means which can say if you've had the infection, but it doesn't tell you when, right? And people like to get tested for that because as you're hearing, a lot of people are asymptomatic, so they might have had it and they didn't know. So when you're positive for that test, it assumes that you were infected at some point. So and like you said, we're also getting reports that it's not as reliable, and it won't tell you, when you were infected, how soon, or like if you were infected in March, or if you were infected last week. And also we're learning more that even though you have been infected before, we're also getting reports that you can get reinfected. So just because, and again, we're learning more about COVID. So just because you already got COVID before, I wouldn't, I would still be cautious because you may be reinfected again.
Great. All right, Kim, you may, there you go. Oh, you need to unmute, Kim.
I had two questions. You just answered one of them. My other question's a little odd. I'm a numbers nerd, and I've been tracking the numbers every day on a handwritten graph. And lately, unfortunately, the page can't even contain 1 week because the numbers are so high.
Yes.
I'm looking for something positive to focus on. And is there any kind of ballpark formula to use to figure out how many active cases there are versus the immense number of total cases? Like, can you say, like, right now in the community, do some kind of subtraction and figure out how we can talk about the number of recoveries that we've had?
So because we have so many, like you said, we have so many cases, right? And we're monitoring a lot of numbers. It's very difficult, for us to do that with the numbers that we're getting. So we're not tracking the recovery rate, and we've been asked that before. We are tracking hospitalizations, and that's being reported, and we're tracking the number of deaths. So unfortunately, we don't have the resources to follow each of the cases within the time frame that they're sick, and that's why we're not able to track the recovery rate. But because we're tracking hospitalizations and deaths, we're assuming that if people don't, aren't captured in those categories, that they have recovered. It's just so, the numbers are so large that, it's a struggle for with the resources that we have. And we're hiring a whole bunch of people, but there's so much work that is involved, with COVID response. Every case that's reported to us is called and interviewed. They're, provided an isolation order. When they've identified their close contacts, those contacts are called. You might be hearing, a lot of, in the news or in reading, the contact tracers or contact tracing. And those are the people that are trying to call the people that have been in close contact with a positive case, so that hopefully we can quarantine them and prevent further transmission of the disease.
Thank you very much.
You're welcome.
Right. Steve Rosenthal.
One of the areas that I'm concerned with is if someone is working outside the county with different rules and then comes back home, is there something they should do before they enter the house? Some people have said change their clothes and then shower. I mean, is there a best way to try bringing it to prevent that? Because the other person is in an unmasked manufacturing area in Orange County, which has different rules.
Mm-hmm.
So if he comes home, what's the best thing that he could do to protect the people?
Yeah, so, we've certainly a lot of people, they try to be cautious. So if they think they're infected, a lot of them, like maybe take off their clothes and leave it by the garage or, by the washer dryer because they're concerned that, that maybe they have the virus with them. But the main thing, I think, that if you just, wear masks, continue to, the major thing that we really emphasize is continue to, wash your hands, right? If there, or use hand sanitizers. And if you're not able to do that, to avoid touching your face, your nose, your mouth, your eyes, because that's one way that the virus can get into your body. So, but certainly any kind of, disinfecting, whatever is helpful to you and makes you feel safe, then,
Thank you.
we would urge you to continue to do that. Mm-hmm.
Thanks.
Yes, Guy Eisner.
Christy, one of your first slides showed the industries or companies, or I should say the broader sense of closures.
Mm-hmm.
Can you explain what is considered a non-essential office user? I'm just curious. It's a pretty broad term.
Mm-hmm.
So, is that entertainment, medical, accounting? Can you give some ideas,
Sure.
kind of drill down of what is non-essential?
So essential is really what you need to be able to function, right? That's why the restaurants were never closed. I mean, the indoor dining was closed, but they were allowed to keep, drive-through and takeouts, right? Because eating is essential. Healthcare is essential. Things that you need to do to be able to function daily. So those things that were closed, those are the ones that are considered at this time non-essential, that we could still continue to live and function our daily lives if those are closed.
is there a list that's published that gives you different categories that are
Sure, I
non-essential?
think there, and then I'll send you the health officer order that was sent out, and that gets revised again because based on what Governor Newsom does, then our health officer order in LA County, we try to make sure that it's aligned so that we don't confuse people. And I think it says it there, so that's another thing that I'm going to list here to make sure
Thank you.
it's sent to you. Mhm.
Great. Does anybody have the next question? I have another question for you, Cristin, if I
Sure.
may.
Mhm.
And I'm just going to be the Cro-Magnon in the room at this point. Is it, we've opened up things before, and some people have said we've opened up too quickly. But is part of it also that people just can't behave and follow the protocols?
Well, yes. I mean, I talked about the in one of my slides that yes, we've seen, because we've had health inspectors deployed out on the field. There's a and so that's why we were deploying our health inspectors to make sure that they're complying with the regulations, and that if there are violations, that those are followed up on. But yes, we think that that contributed to that, because once a lot of things were opened, we had a lot of outbreaks, we had a lot of community transmission, and the cases were increasing. But it's not just, it's a lot of things also, right? I think when we opened these establishments, some people had a sense that it's okay now, that it's safe, that somehow the virus is not as deadly, but it's the same virus. It's the same virus that we thought was deadly from the beginning, right? And just because we reopened certain sectors, it doesn't mean that it's less dangerous. And so in addition to these things that opened up, and like you said, and I confirmed that weren't complying, people started gathering. The holidays, there were a few holidays that passed, and so people were having parties, things like that. So that's why all of those contributed to the increase in surge in numbers. That's why I'm saying that this is a community effort. The public has to do their part, the businesses have to do their part, and certainly the health department, we will continue to provide as much guidance and protocols that we can to ensure that we're helping you reopen safely.
Sure. And I was listening the other day. Is part of the solution being able to hire more inspectors and putting, I don't know how to word this properly, but putting the authority on those inspectors, much like grading a restaurant with an A, a B, a C, to, be the governing policy with those people who are complying and those who aren't. Like I know some restaurants had to close down who were drive-through Hugo's, their taco stands, not the restaurants, had to close down because they were getting, people being violent with them for asking them to wear a mask. And there could be another authority there that could say, not the restaurant or the business, but could make people comply, because I think it puts a business in an awkward position to ask that when you have an irate customer who will not comply to the social distance wearing a mask.
So our health inspectors can enforce the health officer orders. They do, and they have closed. We've closed businesses, we've closed restaurants, but LA County is just so large, and with so many businesses that we have, it's really hard to monitor, especially like the smaller businesses. Certainly, we try to collaborate with the, individual cities, because they also have law enforcement that can maybe help with the enforcement. But it's just really difficult. So we're focusing on like the bigger, higher risk settings that we can regulate. And those for sure are being, violations we're following up on violations, and businesses are being closed.
Thank you. I have Guy Eisner, but I just want to say that Yes, because I mean, it would be nice to have more inspectors because then we could keep the good businesses open.
Yeah.
Open who are complying and, you know, shut down the bad ones. But Guy, I'm sorry. Guy, you have the next question?
I don't want to be PC, politically correct, but how's the county looking at protesters? We had an outbreak, you know, we're all pent up, and here we are closing businesses, religious worship areas, and protesters, which what I've viewed on the television, you know, I mean, what happens if we have protesters
Sure.
again and an outbreak of people not wearing masks? You know, I would imagine some of this is spread a little bit from that. Not to be politically correct or anything, but here you have hundreds, if not thousands, of people protesting, and we were hit in the Miracle Mile area with some fires, and these protesters were on the street, and I watched it, and there's a lot of people weren't. So I'm just wondering if we're in that situation again. You know, you're cramping down on businesses, establishments, and then, you know, free speech is open, but I'm just wondering the viewpoint from you know, the health department on this issue.
Sure, that's a great question. So we can't stop protests. They have a right to do that. You know, outside, inside, we can, you know, control that. We can say that there's no indoor protests, but outside, we can't stop them from doing that. But I will say that we have staff that we've sent out, if it's, you know, safe to do so, that have been providing masks and some informational pocket cards to make sure that, you know, at least if they're going to do that, to make sure that they're wearing masks. We provide masks to them if we see that they don't have any, and again, try to educate them on social distancing. You can imagine that's very challenging for us to, you know, enforce.
Thank you.
Do we have another question for Cristin? You can either raise your hand or electronically raise your hand if you like. Cristin, I would like to thank you for that on the protest. I was one of the people out there, and what I witnessed was a lot of people handing out masks, hand sanitizers, and of the thousands of people that were out there that day, I think we counted 10 people in the vicinity that we were at that were not wearing masks, and people tended to sway away from them. Now it was difficult to keep the social distancing, but I would say 92% of the people out there to 95 were wearing masks, which it was nice to see. And I felt safer out there than I have in some supermarkets where people were in there with no masks and bumping right up against me to get to the next tomato. So anyway, we thank you for that.
Sure.
All right. Thank you so much for being with us today and for sharing those excellent resources. If you can share those slides, that would be awesome. Just go ahead and send them to us and we'll get them out to everybody.
Sure.
And any parting words of wisdom?
Again, I just want to thank everybody for their efforts. I know, like I said, it's very discouraging. I get discouraged myself, but I'm really confident that you know, we can get through this. We've done it before. We can flatten the curve. We just need to all continue to do our part, and so that we can get past this. So thank you.
Excellent. Thank you so much. Thanks for being here. So appreciate it. We are going to move into our roundtable to hear from all of you members. But before we do that, we have Officer Kirby here with us today. Wave, Officer Kirby. And if you wouldn't mind unmuting, and he agreed just to spend a moment or two to talk about a little bit about what's happening with crime in the age of COVID here in the Miracle Mile, and just a real kind of synopsis of, is it up? Is it down? We hear lots of anecdotal things about one thing or the other, but any words of wisdom you can share about what's really going on?
Well, since we're, this area became the focal point, what happened, the Fairfax and, all the protests and things that started at Pan Pacific Park, our crime has pretty much been down. Because with COVID, a lot of the businesses are closed. A lot of the retail establishments are, in a sense that when they don't, under normal circumstances, they don't have somebody at the door checking for temperature. In a sense, it's usually security. So usually people see that at the door, and they're not not inclined to shoplift or things like that. So, but for the most part, all our crime's been down. We did get a spike in all the burglaries and the looting and all that stuff, which counts. And so
Right.
that was just a one-off type thing, in a sense of, we know for, a day, all this stuff happened, and it took a few days for all the reports to come in, or even a couple of weeks, because some of the, shop owners boarded up and didn't come back. So, and so once they come in and then assessed and whatnot, so we got a spike in that area, but we know where that's from and what it's equated to with the protests. But overall, I mean, like I say, crime is down, but for the most part, we're staying at home. We're not, doing a lot of, you got to be, like I said, my job is community relations, is crime prevention. So, I mean, we're preventing crime when we're at home, when we're safe, and, you protect your house and you lock up and all those things. But if you don't put yourself out there to be a victim, then you won't. So the less people on the street, the less people out, the less victims we have, and the less businesses that are closed, or you don't have incidents. So that's kind of been the thing the last few months.
Officer Kirby, has there been any increase in residential break-ins?
Not really. I mean, there have been some, but for the most part, people are home. So I mean, a good thief is trying to do things when they think that you're at work, or if they know you left for the evening, or they're trying to, they're planning. They're not just randomly going. And then for the most part, a more serious, what we call a hot prowl, is if somebody's breaking into your house while you're at home. So the one thing that we've had a problem with in Wilshire, and some of our older, and you're in real estate, some of them have the windows that they're not the modern windows, and and they have to prop them open, so or the crank type windows where you can kind of pull on it and open it or whatever, those things at night. But I think people are getting the word to, you can't leave a window open, or you got to put some kind of blocking force if you want to leave something open when somebody's not going to make yourself a victim. So but for the most part,
Awesome.
Things have been pretty good.
I have one more question for you, and that has to do, I don't know what the technical term for it is, but this thing that's been happening in the intersections in the middle of the day, where 100 or 200 people come, block it off, and there are muscle cars doing, circles in it. It's happening at Fairfax, at the Asterisk there at Fairfax and San Vicente and Olympic. It's happened at a number of other ones nearby. I'm wondering what you're hearing about that, and if they're continuing, or if there's anything being done that's effectively stopping that.
Well, it's on our radar now. I mean, traditionally, since I've been here at Wilshire for a while and doing community relations, it wasn't never there'd be an incident here at Washington and Crenshaw or something like that on a Sunday or whatever. But just in the last month or so, it's come on our radar to the point where we're now Sunday night sending units or into those problem areas. But this has traditionally been more of a South End issue. They had a task force that they run off of Crenshaw, and if they do a good job and run them off of Crenshaw, obviously they come up Crenshaw and they go past the freeway. Now you're in West Bureau, and and then it's a different thing. So I think, and then traditionally we've had issues in the valley. So our valley traffic, our south traffic have task force that deal with that on Sundays or the evenings and the weekend nights, dealing with cruising and street racing and things. So now it's on our radar for West Bureau. So we're working with our West Traffic Division and motor cops, and and see what we can do as far as more effort. But now we kind of know where things are happening, so we're looking in those places. So, but I mean, you know, if a group of kids, you know, on social media say, hey, we're going to meet at this intersection. I mean, with social media, driving time from wherever they are, I mean, they're there. And that's kind of how these things kind of, you know, begin.
I believe Meg McComb had a question. Meg, can you unmute yourself?
Yes. Can you hear me?
Yes.
Okay. This is probably not so much a business issue, but neighborhood, and I'm with Wilshire Vista, is that the number of reports of people who are having packages stolen. And one assumes you're home, the package comes, you know that it's there, you're going to pick it up from your front porch or wherever it is, and that's not going to be a problem. But apparently it is. And I'm just wondering if you have any words of wisdom on that.
Well, like I say, the issue with that has always been on the consumer and the delivery service. I mean, can you guys all remember when you had to sign for a package? So I don't know, you know, when it changed where they, I think it's because of the sheer volume of it. Because I remember going to FedEx years ago, and there's a line of people trying to pick up packages that, you know, they came, you weren't there, and they, you know, leave a sticker, and then I've gotten into arguments, and it's like, oh, it'll be here, well, it's still in the truck, and it's this thing and whatever, and, you know, and those issues, I think, to the point where now, you know, Amazon joins in, the post office, everybody's ordering online, so it all of a sudden it's the new normal just to leave whatever it is, you know, and ordered a new Apple computer for my son for his master's program. And, you know, and you're scared to death because you're, you know, hey, okay, what time is it supposed to be here? And you know, you're looking out of the window every 5 minutes to make sure you don't miss it because you know, obviously don't want to leave something like that on a front porch. So it's one of those things, but then the more organized groups are following the trucks. It's not necessarily random. I mean, people do see things. If they're sitting there, they might take it, but for the most part, they're following these trucks and they're looking for certain items. So if they know that certain things are on the truck, that's what they're waiting for it to be offloaded. But it's just one of those things. I mean, we try our best. Hopefully people have bought into like Zoom or camera systems and things like that to get alerted to when, you know, things are on your porch or whatnot. At least if something does happen, at least you might have a video or, you know, some kind of evidence that, you know, that it was taken. Obviously that helps in the recovery with insurance and getting it replaced, but also it helps us if somebody did do something like that. We got evidence of who took it and what we're looking for. But I mean, there have been crews here and there. I mean, we do our best, but then understanding that theft-related crimes right now, and this is unfortunate part because of the COVID, we're not keeping anybody in jail for their $0 bail for thefts and things, and including car theft. I mean, we had a guy try to steal a car, got arrested, goes to jail, gets processed because it's a theft-related thing, gets out. The next day, he goes back, try to steal the same car and gets arrested again. So these are things that, you know, made it up to, you know, our court system and legislature. So this now current thing is if you were let out because of you got a $0 bail, at least you get arrested the second time, they're going to keep you. But I mean, that's a real thing that, you know, I mean, obviously the health is one thing, and I know, but, you know, the sheriff and everybody, they're kind of upset to a certain extent, but, you know, because of safety, what do? You know, we're letting people out. So just as best as you can with the packages, just try to arrange to make sure you're there. If not, you know, like I said, we always say, get it delivered. Like, you know, my mother-in-law lives close, not far from where I live. You can get things delivered to relatives' houses and things where you know somebody's going to be home.
That's great.
All
Chuck,
right.
I know you want to move on, but I have one more question for Sergeant Kirby. If you could answer this like a minute or two. I'm going to bring it a little bit back to health. How is the police department and first responders that you work with, how are you guys dealing with COVID-19? Because you interact with so many people on a daily basis.
Well, I mean, like I say, with the stats and things, and I can tell you just firsthand here at Wilshire, the way this whole when everything started, and we had initially 4 employees that were affected, and basically, you know, quarantine, off work, you know, they come back. And we didn't have anybody at all who stayed at 4 for the whole time until just last couple weeks. And then we got 4 more. So we got 8 people or 8 employees here at our station that's been infected, and that are I think of the last 4, I don't think they're I know a couple of them are not even back yet. So it hasn't even been 14 days, or the quarantine period hasn't even gone away. So so that's doing good here at the station. I mean, the city is in all the protocols that you're supposed to go to. We're taking temperatures when you come in the station. Our front desk is our front desk is closed. All employees enter from one door. You have to wear a mask here in the station. We're wearing masks out in police cars. All of our officers have N95 masks if they're supposed to wear the N95 if they're going into a hospital, or if you dealing with somebody that you know for sure has COVID. You know, so we have the protocols and things in place, but it's you know, it's just you know, we have to deal with people, and you know, you can't avoid somebody because they have it, but you just have to, you know, put on your PPE. And I mean, if you know, we all have gloves and everything that you know, that we're supposed to have, you know, but like I say, we're just taking the precautions to make sure that we don't get affected and take something home, but nonetheless, we're doing the best that we can.
Thank you.
Excellent. Thank you so much for doing that impromptu. We so appreciate it. I saw you standing there and said, "Oh, I've got some questions for you."
No problem.
Thank you. I so appreciate you.
And I just want to say, well, let me just add, I do miss you guys. I'd say my schedule did change. You guys meet on Thursdays, so a lot of Thursdays I wasn't even here at work because I was working weekends and things because of our initial deployment, because of the whole COVID and things. So we're kind of getting back to normal, but then, like I say, we kind of hit a hiccup here in you know, in the county here, or the state. But you know, we're doing our best, but we're trying to get back to normal. But to most as we can, we'll start seeing us more.
Great. Thank you for what you do.
No problem.
All right. So we just have a few minutes to go through. We don't have that many people left on the call, so we can go ahead and give personal attention to everybody here. We thought it'd be nice to hear from you. If you can turn your video on, that would be excellent, so we can actually see your lovely faces and interact a little more personally. So if you have the capacity, Jennifer or Mariko or Lisa or James or Christy or David, go ahead. Let us see who you are. And we're just going to go through and give you a moment and talk about how we can help you in your business. You have 1 to 2 minutes just to quickly say, hey, this is who I am, this is what I do, and this is the help that I could use in whatever it is that I do. So it might sound like this. Hi, I'm Chuck Marquardt. I'm with Red Real Estate Group, and I could use referrals. I'm looking for listings and for buyers, but more listings than anything, because there's almost no inventory out right now in the Miracle Mile area for any homes for sale, or really throughout LA. The inventory is really low. So if you know of anybody, have them give me a call. I'd love to hear from you. That's what it might sound like. And I'm wondering if Adriana, are you there?
Yes.
Let's unmute Adriana, and then we're going to go to Mariko after that. Hi, Adriana.
Hello, thank you. Thanks for that presentation. I'm with the Academy Museum. If I haven't, I think I've met quite a few of you already, but our latest news, if you haven't heard, is due to COVID and everything that's been going on, we have had to push out our museum opening date. So we will be opening on April 30th, 2021. Really, the decision was made because of the circumstances, and we want to make sure that we're taking the proper protocols and keeping everyone safe. So we had to make the call, but we are moving steadily along. And if you're around the area, you'll see we have people going in and out safely. So we are continuing work as best we can, considering the circumstances. as far as what can we use, just tell people about us. Tell us that we're opening in April. Let people know that we're here. They can go to our website for info. Just spread the word.
All right.
Mariko,
Thank you so
want to add anything?
so much. Thank you for that. Mariko, you're up, and David Gershwin, you're going to be next.
So I'm Adriana's colleague. Just want to say
right.
hi. So yeah, we both work at the Academy Museum together. So I'll just echo exactly what you said. It's good to be here with you all. It's a little weird. We're trying to build community, yet we can't be around each other. So, so tell people about us, and we're looking forward to kind of continuing to communicate, as our plans evolve, what's going to be happening. We're still planning some sort of a neighborhood celebration around our opening, but it all depends on how the world looks when we do open. So thanks for bearing with us, but yeah, thanks.
Excellent. We're glad you're both here. David, you're up, and Kim, you're going to be next.
Great, thank you, Chuck. Most of you know this already, but I do what's called public affairs. So if you have a project in the city of Los Angeles or in the Miracle Mile area and need to get the attention of members of the city council, or even work with our local Mid-City West neighborhood council to get their approval, or to facilitate discussions with them, I can help you with whether it's a project or an event, some sort of issue where you require some sort of municipal approval. I can help you with that. So looking forward to just like Adriana said, to re-engaging with everyone in person. This has lasted far longer than I anticipated, but it's good to see that everyone's healthy, and I think we're showing how strong and resilient we are.
Excellent. Thank you so much for being here today, David. Kim, you're up, and then we're moving on to Lisa Barnett.
Hi, my name's Kim Orlando, and my company is Making Space Work. I'm a professional residential organizer. I typically go into a client's home and help them troubleshoot how to reorganize their space, how to declutter, do the hands-on decluttering, get in and work side by side with them to create a more welcoming environment for them. I have not been doing that, clearly, because of COVID. My job avenues are very restricted. So I've been doing some virtual work where we can actually work via Zoom or FaceTime, and it has proved to be effective. So I'm doing that. I also do inventories, and I'm starting in on photo organizing. So again, referrals are always helpful. If you know anyone who needs this kind of service, please keep me in mind.
Great.
Kim worked on a job for a client of mine, and he raved about her and the work that she did. So if you need a referral, we've got it for her. She's amazing. All right, Lisa Burnett, you're up, and then James Spinozo, you'll be next.
Hi, everyone. I'm with the Holocaust Museum, and my colleague Jill Brown is also here in the meeting. And so I'm going to defer my time to her because she is in charge of a lot of exciting things that are going on. But it's great to see everybody. Thank you.
Good to see you. Well, let's just then move on to Jill really quickly. James, you'll be up right next. Jill Brown, go ahead.
Hi, thanks, Chuck. So I'm with LA Museum of the Holocaust in Pan Pacific Park, and we are closed and will be closed for the foreseeable future. But we are doing our best to make our content accessible to everyone at home or wherever they are. So our education department is working closely with teachers and administrators of schools to provide virtual tours and lesson plans and anything that teachers need to teach Holocaust history, and they'll be doing more of that when school opens in whatever form in the fall. And then we're also producing public programs that are available to everyone versus on Zoom. So we have usually 2 programs a week, ranging from Holocaust survivor speakers to panel discussions. We're doing a monthly series called Building Bridges, that brings together representatives of different communities, the Jewish community, the Black community, Latino, Asian, and we're talking about issues of racism and how people are being affected by COVID-19, and just trying to, continue the cross-cultural community conversation remotely. So There's something for everyone. Feel free to check out our website. Thank you.
Thank you, Jill. James, you're up, and then we'll be moving to Karen Woodward-Sorrow. James, let's unmute you.
Got to unmute.
Thank you, Chuck. Thank you, Meg and Chris, for another great program today. Steve and I are ramping up a TARFest 2020. An event will take place this year. We don't know how much of it will be large gatherings, but a portion of it will be virtual. And we are planning an innovative dance program in collaboration with the original Farmers Market. So that's in the works and under negotiations right now. I want to personally thank Steve Rosenthal and Olympia Medical Center, one of our longtime supporters, and they've committed to support again for 2020, and that's amazing. We do have support lined up through our normal avenues of Department of Cultural Affairs and Councilmember Rue. So we're going to make something happen and make something that you all will be proud of, and hopefully all attend this fall. It will not be one day. It will not take place at the park. It'll take place at various venues throughout the Miracle Mile. We'll be able to activate some different venues, but it will be top-rate arts programming that you all enjoy. Thanks a lot, everybody, for being here, and thanks for your time. Look forward to seeing you all soon.
Thanks, James. Karen, you're up, and then Steve Rosenthal.
Okay. Hi, everybody. So we're still making masks, and I just want to thank everybody who's bought masks. Thank you, Meg, and also the Larchmont. They've been giving away masks for free if you subscribe to them. So if you want to support them, that would be wonderful. And if you don't already, and we're developing Art Hype in North Hollywood now, and the lights go up tomorrow, and we signed with artsy.net so we can expose the artist membership to more collectors online. And so, yeah, things are moving forward. And and I'm also doing oil portraits now for, I have one client, and I'm doing portraits of her pregnant with her horses. So if anybody needs any portraits, that also goes to support arthype.net. And if you want to follow us on IG or Facebook to keep up with our updates, they're both Art Hype now. So you'll keep up. And thanks, everyone.
Excellent. Thank you so much. Stephen, you're up, and then Guy.
Thank you. First of all, Chris, thanks for putting this together. And Chuck, you are a master of ceremonies. You truly are. You really know your stuff. You even got the look. You know, game shows are next. You're ready for that.
Oh Lord. Oh, dear.
Anyway, James again.
And then the presidency.
That'd be great.
And I want to remind everyone to support James Panazzo and the TARFest. Olympia is doing what we can this year. One of the things that is a big problem with the hospitals financially, and Cedars is going through at Huntington Memorial, Olympia especially, is that people think that hospitals are closed for other issues. So what's happening is the volume of hospitals, people are putting off hip replacements, they're putting off even some heart and back and lung surgeries. They're putting that back, and they're not coming to the ER for anything because they're afraid that they're going to catch something, as you know. So you'll see the Cedars promotion is we're open, and so is Huntington Memorial and Olympia. We're doing the same thing, is we are open for business. We triage anyone that comes in the door. There's a test for each employee, for our doctors, and for anybody visiting a patient. So we're playing it extremely safe and within the guidelines of the governor and more. And just to let you know that we're also thanking our chamber members. We have a Gift Global initiative, which raised money for our employees to help feed them so they can take a little stress off their day, and the farmers market as well. So just to let you know, we're thanking our chamber members as well. So thank you, and everybody be safe. Thank you.
Thank you so much. Guy, you're up, and then Lenore.
Thank you. I'm a commercial real estate broker. I represent office users and only occupiers of office space. And if you have anybody who needs to relocate, expand, or downsize, I've been negotiating with many tenants along the Miracle Mile area to give them some rent relief, which has been very challenging in this climate. That's really about what I've been doing. And it's been challenging touring people through buildings. It's a very interesting protocol. I've been touring a bank board through downtown and through this entire process, about 18 buildings. And I see that the high-rise office landlords have taken this very serious. Just to share a quick story, I was at a downtown building. No one was there. I was talking to somebody, and a security guard came out of the building, the lobby, and I'm in a plaza. There's absolutely nobody there. And he said, "I'm sorry, but you're on our property. You got to wear your mask." I looked around. I said, "Seriously?" He goes, "Yes." And I put my mask on. My bank board people showed up, and they're all like kidding with their mask down. I said, "You got to put your mask up." And the guard came back out. He said, "Everybody with the mask back up." And it's interesting because these board members of a bank are much older than I am. And I was really impressed that they went out physically to look at buildings through this entire environment. It's scary, but landlords are taking precautions, and I could see them as time went on through the progression of weeks. You could see that they've initiated these protocols, and it's pretty safe. I think these landlords have taken this very, very serious. Thank you.
Great. I think it's Lenore, you're up next.
Okay, I'm with the Flowers Hotel Group, and we are a full service representation and consulting company for independent hotels and companies worldwide we're based here in Los Angeles. So right now we're just reimagining and refreshing, and hope to be coming back, maybe not full throttle, but starting to come back in 2021. Because as you know, the travel industry, hospitality is really going through to try and regroup and see how we can get people back out into the hotels. And it's a slow process, but there are hotels that are booking, and people are going with their families, like Monarch Bay and Orange County, and the Pelican Bay Hotel, they are booking. And it's slow, you know, not all the restaurants are open, food and service. So it's kind of crawling a little bit to see what the response will be. So it's a difficult time, let me say, for hospitality in general. But we hope to be back in 2021 and doing our events, and because big events have been canceling, global business travel, the GBTA has completely stopped all the conventions. So it's pretty serious. But my daughter traveled to Hawaii last week, and she came back and stayed at her friends. So people are slowly venturing out. So we're recommending motor vacations, motoring to your destination. And so there are wonderful hotels that are within a radius of Los Angeles, Santa Barbara, Napa Valley. Yeah. So that's what we're doing. We're reimagining and refreshing.
Right, as are many of us.
That's right.
Thank you, Lenore.
Okay.
And Chris, real quickly.
Oh, well, I could use, let's see, hold on, I was just about to do our raffle. So you took me off guard there, Chuck. I do graphic design work, editing, photography, and I do photography work, retouching as well. So if anybody needs that or wants that at this moment, I do all of that, as well as I do computer tutoring. I've been doing Zoom sessions with people. It's been, we've worked it out. We've worked it out so it works well. And on the chamber front, thank you, Chuck, for including me. On the chamber front, we are still rethinking and reimagining the directory for this year. We were going to, before Gavin Newsom's announcement, we were going to start it up back in August for a September release, which we'd still like to do. But it might be a smaller production run this year, because I know a lot of businesses are struggling and can't afford ads, and that's how we pay for the printing and distribution of the directory. So that's on the directory front. But we're still continuing to do free member updates during this time. So if you have anything about your business that you would like to get out to the membership, just send it to me, and we will post it in our weekly member updates, as well as on Facebook.
Great. Thank you for that, Chris.
Oh, can I say one thing?
Yes, Lenore.
Oh, Jody and I, we met at Rocco's on Wilshire a couple weeks ago, and it was outside, and it was really nice going there and supporting the restaurant. It was out. She has tables outside, so you can go there.
Anything we can do to support our local restaurants, right? And Meg just got on the phone. She just got on the phone just as we were going to her. I know.
Meg, we need you.
Do you have the list of raffle items, Chris?
I don't, Chuck.
All right.
I feel like you're Ed McMahon. You know what? I don't, Chuck. But Meg, if you could unmute yourself, you can read off the raffle items, and I'll do the electronic picker.
I'm back.
Okay, great. Choose order from Rocco's. Oh, by the way, before I go to the raffle real quickly, please support your member restaurants today. I put a list out in an e-blast recently, and if you could do that, that would be terrific. If not today, then this week, that would be most appreciated. I'm going to go right to the raffle, so I'll be distracted.
Okay. We have Mr. Devlin Studio is producing fabulous masks. And so he is donating 2 of those to the lucky winner, who is...
Lucky winner is Jane Gilman, who's not here, so we have to call again.
Whoops, never mind.
Guy Eisner. You'll have
Eisner.
Next meeting.
You got it. And then a fabulous wooden jigsaw puzzle. We all need to have something to do, from Nutmeg. Who gets it?
That goes to Cassandra Jolton, who is actually not here, unfortunately, at the Grove. So I'll draw again. Oh, there we go. Michelle Mena, are you here? Nope, I'll do it again. Hold on 1 second. Adriana, are you still on the call?
She just left.
Oops.
Must be present to win.
We draw again here. Elka, is Elka still on the call?
She was. Not anymore. I still have a chance.
Got to stick around. Karen Sorrow.
Karen, all right. Karen, are you here?
Yeah.
Okay.
She's right there. She's on mute.
Excellent. Okay. Fanciful are fabulous baskets. They are giving us a beautiful basket, and that basket goes to
Michael Rosenzweig. Is he on the call? Is Michael on the call?
No.
Oops.
Okay. I can't see anybody because I'm doing this. So.
All right.
Yeah. Let's see. Jennifer Harbick, our new district rep from Ted Lieu's office.
She left.
I'm on it. Lisa, are you on the call still? Lisa Burnett.
Yes, she is.
Yes, I am.
Yay,
Thank you. And my dog is very excited. Thank you.
You're gonna love. Maybe they have dog treats they put in that thing too. You can ask. All right. A beautiful bouquet from Urban Florist goes to...
Not there, not... Hold on, I'm drawing. Jane Gilman could have won it. Mernouche?
No.
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 Hold on. Some of these people I see are not here anymore. Jill Brown.
Yay! Good for you,
Excellent.
Jill.
Okay, now, not all of you are, congratulations, not all of you are aware, but Christy Tarpley is a notary, and she's with our office at the Kramer Law Group, and she's offering a notary service. You need to come to 5054 Wilshire, and but up to 4 people. So 4 notary signatures by Christy Tarpley go to.
Here we go. Not in the meeting. David Gershwin.
David, still there?
Still here, but muted.
Yay, David, perfect.
Awesome.
Excellent.
All right. Was that the last one?
Yes, I'm afraid so.
That's wonderful. Excellent. Well, we want to thank everybody once again for joining us today. It's so good to see your faces. Thank you for unmasking yourselves virtually as well as otherwise. And so good to see all of you, Jill and James and Kim and David and Karen and Guy and everybody. It's always such a pleasure. We can't wait to see you next month, and you'll be getting information in your emails about exactly what incredible speakers we're going to have at that point as well. So any final words, Chris or Meg?
No, we're good.
Thank you all for coming. And we're
all right.
For the people who are here, a little spoiler alert, we're working on Karen Bass for next month, which would be terrific, both speaking on what the federal government is doing on the pandemic, and as well as the Congressional Black Caucus, and how we can become more inclusive as a chamber and as a community.
Wonderful.
Excellent. Thank you so much. We'll see everybody
Thank you.
next meeting.
Well.
Thank you.
Bye-bye.
Yeah.
Bye.